Many people inject biostimulants into their face, and they don't realize it's completely different than a skin filler. Skin fillers are mostly hyaluronic acid, or HA, and those can be dissolved and they're a bit reversible, but they do leave a horrible amount of wrinkling, skin, and swelling. However, biostimulants work in a completely different way that is trying to develop more collagen or more growth of the natural tissue. Now, Sculptra contains PLLA, which is a poly-L-lactic acid. It works differently from traditional skin fillers, and rather than simply adding volume, it stimulates your body to produce new collagen over time. It's excellent for patients with a generalized facial volume loss, and you can put it in temples, in the cheeks, lower face, and with a stronger, kind of more prominent jawline. And the results are gradual, and they can last for even 2 years or more. And the next major type is Radiesse, which contains calcium hydroxyl apatite, or CAHA, which is not a hyaluronic acid, it's a hydroxyl apatite. And Radiesse provides immediate volume and contouring while stimulating the collagen production. It's particularly useful for defining the jawline and improving the cheek and giving a little bit of filler to certain areas, but when you dilute it, you can actually thicken crepey skin a little bit. I don't really like that because it can get all clumpy. And another option that I have seen is Enlancé, which is not available in Canada or the United States yet, but people do come from further away to see it, and they have it. And it's a PLC, which is polycaprolactone. It also can stimulate skin for many years. However, we don't have it in Canada or the US yet, so we're not going to be able to use it yet. But there is the final one that is available. It's called Renuva, and that's an allograft adipose matrix. So that means that it's like a fat matrix where you use a scaffold and it encourages your own fat cells to grow into the treated area rather than a collagen. My preference, however, is still autologous fat. Once you understand how fat grafting works, we can usually get much better results than these artificial fillers that are more unpredictable. Remember, you cannot dissolve these biostimulants. They're there permanently, and they can be there for many years. So they have to be placed completely 100% properly. And if you're interested in learning more about lifting and contouring and rejuvenation, well, you'll have to speak to a surgeon, because fillers do not actually lift. They can make you look puffy or add volume, but they are not actually lifting anything. For a selected contour defect and volume deficiencies, you can actually use a biostimulant, and it really should be done by an experienced injector. It's very difficult to correct mistakes after they've occurred, and I do see them a lot from other people, and we'll try to work with you. But the deep plane facelift combined with fat grafting is probably the most comprehensive way for natural rejuvenation. So I'm Dr. Huck, and I can help patients understand the full spectrum of facial rejuvenation options so they can choose the treatment that's right for them. So give me a call if you're interested to learn more. Thanks.